Next one, here the direct vasodilators. So direct vasodilation, what happen if our blood vessels are constricted? So what happened, the blood flow will be passed, so it takes so pressure to flow. So what these drugs will do means they will dilate the vasomotors, blood vessels, so there will be a normal blood flow. So in this also two types are there. Arterial vasodilators are there, arteriovenular vasodilators are there, arteries and ventricles like that. Next, in this arterial vasodilators there are three drugs like Diazoxide, Minoxidil, Hydralazine. So let us see the mechanism. Dioxides means what this will do, this drug will combine with ATP, modulated potassium channels, which are present in vascular smooth muscles. So what this drug will do, it opens the potassium channels which was present in vascular smooth muscles, thereby it cause hyperpolarization and then relaxation of vascular muscles. So our concept is, if our muscles are relaxed, the passage of blood vessels is normal. Okay, it will not take a pressure to pass, it will not cause a high blood pressure, so it will come into normal condition with the relaxation of vascular muscles. So we can control our BP. Simple. Dioxides which acts on the vascular smooth muscles, which opens the potassium channels, thereby it causes hyperpolarization and relaxation of vascular muscles. Okay. Next one, adverse drug reactions like fluid retention, accumulation of fluids in cavities or another cells. Hyperglycemia. Hyperglycemia means high blood sugar. Okay. Hyperuricemia means high uric acids in blood. Next one, angina and MI. Angina and MI means it is also called ischemic chest pain, may be caused by the reduced blood flow to the heart. So we know that angina is also a symptom of coronary artery disease. So in this angina pectoris, it may result to MI. So MI means myocardial ischemia. It may be caused by an imbalance between the myocardial blood supply and oxygen demand. So there will be low oxygen demand, and if there is a not proper blood supply, it may cause chest pain. Common symptom is chest pain. So this is all about angina and MI. Next, this drug is used in the hypersensitive emergencies. Next, in insulinoma. So it is also used in insulinoma. When insulinoma means like insulin. So what the exact meaning is these are the tumors in our pancreas. They makes extra insulin more than our body can use. Okay, they excrete more insulin. So insulin that may cause a hypoglycemia. Hypo means low blood sugar. Okay, hypoglycemia means low blood sugar. Hyperglycemia means high blood sugar. So then low blood sugar, it causes a confusion. Okay, confusion, sweatiness, weakness, rapid heartbeat. If your blood sugar gets too low, a person can pass out or even leads to coma. So it is also a severe condition. In this condition, insulinoma, we will use dioxides. Okay, to arrest premature labor. Okay, the dose we will use is 150 mg by rapid IV injection. See here, in direct vasodilators, this dose is given by IV route. Okay, before we all learn that drugs are taken orally only, but here it was taken by IV route injection. Next, minoxidil. The mechanism of action is same. It acts on vascular smooth muscles, open the potassium channel, and it causes hyperpolarization. Here the concept is all to relax vascular muscles. Okay, next, but drug is different, so adverse reactions also will come different. So like tachycardia, fluid retention, hypertrichosis. So here tachycardia means fast heartbeat, regular heartbeat, like that. Next one, fluid retention. Fluid retention means an accumulation of fluid in the body tissues and cavities, like that. Next, hypertrichosis. Hypertrichosis was commonly known as, it was also known as a Werwolf syndrome. Werwolf means exclusive hair growth anywhere on the person's body, either in a woman or a man. There will be a regular hair growth in the body, face, and it also occurs some small patches. So abnormal hair growth occurs, that is called a hyper means high hair growth, trichosis. Okay, next the uses as an alternative to other drugs in treatment of hypertension. So it is also one of the BP tablet, and also it is used in topical treatment of baldness. Why? Because why in baldness they will be used means here the side effects are there, no? Hypertrichosis means abnormal growth of hair growth will be occurred by using this. So here dosage and routes 1.5 mg OD once a day initially, but increases to 40 mg by this is by oral route only. Okay, next one, hydralazine. The same mechanism of action is same. The concept is to relax the direct vascular smooth muscles. How? Means by stimulating the cGMP and stimulate the production of nitric oxide. cGMP, how it comes means guanylate cyclase GC catalyzes cGMP synthesis. This enzyme converts the GTP to cGMP. This was a mechanism, concept where it comes from. So by stimulating this cGMP, the drug will relax the vascular smooth muscles, whereas our BP will come in control. But the adverse drug reactions are nausea, headache, flushing, dizziness, tachycardia, improper heartbeat, fluid retention, accumulation of fluid in cells cavities. So it is also used in hypertensive emergencies. The dose of hydralazine used is 25 to 50 mg once a day by oral route. Next one, arteriovenular vasodilator. Here the example is sodium nitrochrosida. So here the how this will work means sodium nitroprusside. First, this drug will convert into the blood vessels to its active metabolite nitric oxide. First it converts into nitric oxide, which activates the guanylate cyclase to increase the intracellular cGMP. So here this cGMP will lead to vasodilation. See here also same cGMP, but the vasodilation will occur. So this was the process, mechanism of action. Next, adverse drug reaction is hypertension, weakness, nausea, vomiting. Next, it is used in hypertensive emergencies in acute myocardial infarction. So first of all, this dose will be occurring powder form. So 50 mg of powder, it was dissolved in 500 ml of 5% dextrose in water and administered at the rate of 0.25 to 1.5 mg per kg per minute.